Hello friends, let us now learn some important points about the receptor blockers. So in the receptor blockers, we have two types of receptor blockers, alpha blockers and beta blockers. Alpha blockers can be divided into two types again. Alpha blockers can be selective alpha blockers or there can be non-selective alpha blockers. Selective alpha blockers can be alpha 1 blocker and alpha 2 blocker. Beta blockers are beta 1 and beta 2 blockers, which are selective and non-selective beta blockers. In this chapter, we are going to learn about alpha blockers. In the alpha blockers, first non-selective alpha blockers. These include phenoxybenzamine, which is an irreversible non-selective alpha blocker. Phentolamine and talazolin are reversible non-selective alpha blockers. All these will block alpha 1 and alpha 2 receptors and thus causes vasodilatation and postural hypotension. They undergo vasodilatation and postural hypotension. These will also cause reflex increase in sympathetic discharge, thus leading to tachycardia. These phenoxybenzamine and phentolamine and talazolin, these are used in the vasomotor reversal of Dale. These in vasomotor reversal of Dale, along with the epinephrine, before giving epinephrine we give alpha blocker. So first we will see it in vasomotor. In normally, whenever you give epinephrine, initially the alpha receptor at higher doses of epinephrine concentration, alpha receptor gets activated and it causes vasoconstriction, causing increased blood pressure initially, and later as the doses decreases, the beta 2 receptor gets activated, causing vasodilatation, thus decrease in blood pressure. So in vasomotor reversal of Dale, initially you give alpha blocker, so alpha receptor is not activated. So at later doses, beta receptor is activated, causing vasodilatation and decreased BP. So this graph is called as vasomotor reversal of Dale. Phenoxybenzamine is the drug which is used to prevent hypertensive episodes in pheochromocytoma. So phenoxybenzamine is a drug of choice for pheochromocytoma. Then the drugs phentolamine and talazolin, both these are used in the treatment of hypertensive crisis in clonidine withdrawal, and this is also used in cheese reaction. So if you see, the side effects include, these are alpha blockers, so they will not cause vasoconstriction, thus they causes vasodilatation leading to postural hypotension, which causes reflex tachycardia. This vasodilatation causes cerebral hypoxia, which leads to vertigo and fainting. This alpha blockers also cause retrograde ejaculation because of the seminal vesicle receptors. These alpha blockers also cause meiosis, nasal stuffiness, and they cause improved urinary flow due to sphincter relaxation. So these are the important points about the non-selective alpha blockers. Now let us now before that, the other uses of non-selective beta alpha blockers include Raynaud's syndrome, and this is also used to prevent dermal necrosis. Then if you see, the next topic here is selective alpha 1 blockers. Selective alpha 1 blockers include, first we have the drugs are, we have drugs like prazosin, terazosin, dexazocin, alfuzosin are present. All these are ending zocin, and all these will cause vasodilatation and thus decrease BP, because they will specifically inhibit alpha 1 receptor. Normally alpha 1 receptor causes vasoconstriction, thus increasing BP, but all these drugs will inhibit alpha receptor, thus causing vasodilatation and decreased BP. There is no alpha 2 action here, so there is no increase in sympathetic outflow. So as a result, there is lesser tachycardia. What does this alpha 2 receptor do? Alpha 2 receptor is a presynaptic receptor. So I will just show you the alpha 2 receptor once, so that it becomes easier to understand. So in this picture you can see that the alpha 2 receptor present here is present presynaptically. So when you add alpha 2 blocker here, now I am using alpha 2 blocker here. See, normally alpha 2 receptor activates the noradrenaline release, blocks the noradrenaline release into the in the synapse. See, alpha 2 receptor will block the noradrenaline release into the synapse. So if you use an alpha 2 blocker, this will increase the release of noradrenaline in the synapse. This noradrenaline will act on beta receptor and it causes increase in heart rate, that is tachycardia. So if you use selective alpha 1 blockers, these will not have any action on alpha 2 receptors. So as a result, this tachycardia is less, very less. That means you do not see this tachycardia which is seen here. That is the meaning of the previous sentence. Now if you see the side effects of selective alpha 1 blockers first. So these selective alpha 1 blockers has some of the side effects, like they cause postural hypotension because of decreased BP. They cause orthostatic hypotension or first dose hypotension. So because of this, these alpha 1 blockers are given only at the bedtime, and these also can cause retrograde ejaculation. These can also cause retrograde ejaculation. Next, all these alpha blocking drugs like prozosine, terazosin, dexazosine, alfuzosin will decrease the LDL and triglycerides, and they increase the high density cholesterol, and as a result they have favorable effect on lipid profile. So that is the reason why prozosine is preferred in hypertensives with dyslipidemia, because it decreases the LDL and increases HDL. It is also preferred in hypertension with diabetic mellitus because it improves the carbohydrate metabolism. Then it is also a drug of choice for hypertension with diabetes mellitus because of angiotensin converting. But the drug of choice for hypertension and diabetes mellitus is angiotensin converting enzyme inhibitors. This prozosine is used as the treatment of scorpion sting bite. It is used for the treatment of scorpion sting bite. So for clearing up, see, this prozosine is preferred for hypertension with dyslipidemia. It is also preferred for hypertension with diabetes mellitus, but it is not the drug of choice for hypertension with diabetes mellitus. So what is the drug of choice for hypertension with diabetes mellitus? The drug of choice for hypertension with diabetes mellitus is ACE inhibitors. Now, the next drug is tamsulosin and silodosin. Tamsulosin and silodosin will inhibit alpha 1 receptor in prostate. That is, alpha 1A receptor is inhibited. That is tamsulosin and sildosin. So thus they are used as drug of choice in benign prostatic hyperplasia. They do not have any effect on alpha 1b receptors, that is on blood vessels, and as a result there is no postural hypotension. So I would like to clear this up also once. So here if you see, the alpha 1 receptor is of two types. We have alpha 1a receptors and alpha 1b receptors. These alpha 1a receptors are present in prostate, whereas alpha 1b receptor is present in B for blood vessels. Okay, so this drugs like tamsulosin and siladosin, these drugs are mainly alpha 1a selective, and thus they have action on prostate, but they do not have action on alpha 1b. When alpha 1b receptor is activated in blood vessels, it causes vasoconstriction and thus increases the systolic blood pressure. So this blockade action of tamsulosin and siladosin is mainly present on alpha 1a, whereas normal selective alpha 1 blockers like prazosin, this has both the action on alpha 1a. This will block both alpha 1a and alpha 1b. When prazosin blocks alpha 1a, this action on prostate is utilized in benign prostatic hyperplasia, but prazosin blockade in alpha 1b, if it blocks, there is no vasoconstriction. That means there will be vasodilatation, and thus it gives the side effect of postural hypotension. Right, now with the help of this drugs tamsulosin and siladosin, this side effect of postural hypotension is not present. That is important thing. Now that is one important thing. Then if you see the side effects of this tamsulosin alone, it causes intraoperative floppy iris syndrome. It causes intraoperative floppy iris syndrome during cataract. Then the drugs like indoramine. Then the next type of drugs, which are special drugs like indoramine and urapadil. Indoramine and urapadil are occasionally used for hypertensive emergencies. They are occasionally used for hypertensive emergencies. Then the second group of drugs are selective alpha 2 blockers. The selective alpha 2 blockers include yohimbine and idazoxan. These two have no clinical role. So these are the important alpha blockers. Thank you guys for watching my lecture. Thank you.